All right, so now we're going to do a hip socket set of stretches, right? And so you can put a palm on the bottom of the foot, put your arm under the knee, and notice I'm not grabbing with either of these. And this allows me to use my body to see what is her ability to circularly move in the hip socket. All right, she's not terrible, but what I'm looking for here is what is her range? Do any catch points show up? And am I able to do this without taking her pelvis with it? And what I do notice is as I come out here, instead of the adductors letting go, her pelvis rotates to allow her leg to do that. So for certain, some inner thigh stretches are going to work here. All right, so that's the first assessment, is just what's going on in the hip socket. Am I able to do 360? What limitations do I feel in that circle? Do I notice catch points along the way? And we want to remember that the hip wheel has 18 muscles surrounding the bone here that affect the hip. And so you can think of this as varying slices of degrees. And you don't really want to try to stretch deeply and then roll in a circle, because then you're asking one muscle to stretch to its maximum and then the next one right next to it to jump to a full stretch without any lead up at all. And so you can pick an angle, right? And I can just put the foot on the bolster. I'm going to take this hand and gently traction her ASIS, and I can pick an angle and stretch. And that's a basic, just simple passive stretch. Now if I want to make it active, I can ask her to push her knee sideways out into my hand. 5, 4, 3, 2, 1, and let that go. And that should open up a little bit more. Now, we're going to have a bunch of these, so you could spend time on each angle if you really want to, but notice now I'm going to change the angle slightly. So that was straight across. Now we're going to change the angle this way and get a slightly different muscle. And I could make this active, but I just want to show all the angles. So that's another one. And I want to return to neutral before I go into the next angle. So now I'm going to pick another one that's roughly drawing knee to shoulder. And I'm always tractioning the ASIS to keep her from lifting her hip in this motion. I want to make sure that that's not happening. So we got this angle, that angle, that angle, and then we can do straight up, which we did a big stretch for before. Now, to start to make the circle come out and switch from the abductors to the adductors, we can now draw this out, and now I'm going to traction the opposite ASIS. And I can actually use my body to rest this on it so that she doesn't feel like she's going to fall. And so I'm going to keep going on the clock. So we had sort of 9 o'clock, 10 o'clock, 11 o'clock, 12 o'clock. Now this is 1 o'clock. And with any of these, if you feel like it's really stuck or you need to make it deeper, you can ask her to then resist and try to draw this knee from 1 o'clock down to 7 o'clock. So let's try that here. Nice. 5, 4, 3, 2, 1, and let go. And again, I'm not trying to shove her leg down. I'm just following it to where it wants to go. So there's 1 o'clock. I'm going to draw back to neutral. Come out to roughly 2 o'clock. Draw that back to neutral. Come back out to 3 o'clock. And you could even do 4 o'clock in this position. And if you're feeling like she's pretty open, even though she claims to be super tight, she's reasonably open. Not a lot of clients will allow this. But if you feel like there's a lot of resistance, you can gently place a hand under the leg just to give it the feeling of some support. And I'm just resting my body here, suggesting movement without forcing movement. Nice. And then I can check again. How does that feel? See if you can just drop your leg in space. Oh, that's definitely more open. Right, and keep in mind the angles, we did sort of 9 o'clock. You could do 8 o'clock, but as you start getting down in the clock, you're getting out into extension, and that doesn't really stretch much of anything. So it's mostly from here to here that you really are trying to get things done.